So let's start with osteoporosis. Again, it's a disease of the bone. Okay, it's a very complex definition. World Health Organization. Okay, this is for my exam, not useful. Okay, so what we do need to remember is a condition of the bone. Okay, where it's normally porous. That means there's a lot of hole. I will show you a picture and you will understand. And because of the holes in the bone is less strong, okay, than normal. Okay, so this is the one. On the left is a normal bone. So you can see the volume is the same, but it's much denser. Okay, in the osteoporotic bone, there's a lot of holes, so we call it porous. There's a lot of holes in the bones. Okay, so even though it looks at the same size, we know the density of the bone is less. And if you fall, you crack it, okay, and then you get a fracture. That's the problem. So why are they right? Whether is it an OH disease? So we always think that osteoporosis, osteoarthritis is an OH disease, okay? But there are conditions that can cause early osteoporosis. Patients with chronic medical conditions such as renal failure, liver disease, this can cause osteoporosis. Hyperthyroid, okay, a disease of the thyroid gland, okay, that can cause osteoporosis. Early menopause, any condition that can cause ladies to have early menopause can also cause early osteoporosis. Okay, medication, if you're on a lot of steroids and chemotherapy medication, this can also cause secondary osteoporosis. So these are not really OH disease. It can affect individuals, younger individuals. Okay, so just be careful, take note. It's not difficult to diagnose bone osteoporosis. Okay, so the gold standard is something that has to be done in the clinic or the hospital. Okay, it's called dual energy X-ray absorptiometry. We call it DEXA. Okay, it's a gold standard. It will scan the spine as well as the hip. So this is the gold standard where they use a reference of the quality of the spine and the left hip. So if you go to some malls or some shops, road show, they can actually measure the calcaneum using ultrasound, something that can be done on the spot. Those are not really the gold standard. But it's not too bad to give you an idea whether you're osteoporotic. Maybe if there's any indication, then you can just pop into one of the center to get a BMD scan done. Okay. What is peak bone mass? So our bone will hit the strongest and the highest quality in about 20 to 30 years old. So you keep growing stronger until you're 30 years old, 20 to 30 years old, and remains high until about 40 to 50. You can see the plateau over here. It's the plateau, so it reaches the maximum and remains there till you're 40 to 50s. Then it drops rapidly in ladies, okay, because the menopause set in and then hormones drop, so you lose the bone mass. In male, you drop steadily, okay. So failure to attain adequate peak bone mass is one of the main reasons. So essentially, you don't reach this high level. That means you didn't do enough exercise, you don't have enough calcium, vitamins, so you don't hit the adequate level for it to drop. So again, this OH disease is actually not, because if you know this, you can actually prevent it earlier. You can actually try to exercise more, take in a more balanced diet to try to hit higher peak bone mass, and then you let it drop. Essentially, you're building a reserve of good bone to let it drop steadily. Okay. Treatment, I think the most important thing when I tell the patient is to identify the risk factor. Stop smoking, stop alcohol intake, start exercise, get a balanced diet. All this has very little side effect. Okay, so exercise, diet, taking calcium, taking vitamin. Okay, so this is the amount you need for at a different stage of life. So in calcium, it's about 800 to 1000 milligram. I just popped by to a pharmacy today and I checked a bottle of caltrate. Caltrate is very common. So most of the caltrate, I realized that each tablet is about 600 milligram. So it's more than enough, because 600 milligram is a supplement and you're still taking a good diet. So you have more than enough if you're just taking one tablet of caltrate. I'm not advertising for caltrate, but this is just what I found today. Okay. And vitamin D, I think there's more than enough in one tablet of caltrate. I think most of the supplements in the pharmacy, they have more than enough calcium and vitamin D. There's some side effects like kidney stones. Okay, so drink a lot of water if you take calcium. Vitamin D is actually more of a problem because they are present in very little food and it's mainly through the sunlight. So it's found in very little food, like cod liver oil. I believe most of us Asians don't really like to eat cod liver oil. Salmon, mackerel, all this contain a decent amount of vitamin D, but I don't think we take it regularly in our Asian diet. But try to eat more of it. But more important is sunlight. So I always tell the patient to have 15 minutes of sunlight. And please take note that sunscreen can reduce the absorption by about 95%. So it's important that if you go to the walk in the sun, try to get sun, don't apply a thick layer of sunscreen. Defeat the purpose. There are lots of medication, and I'm not going to use this platform to go through the medication because they are very complex. And most of the time, if you have reached this stage, I will have gotten you to see another endocrinologist who will take care of all this medication because they are very complex and very advanced. They are injection mode, they are oral mode. You have to take once weekly, and you have to check your kidney function and everything. So essentially, I'm trying to say that prevention is better than cure. So prevention. Okay, you don't want to reach the stage where you're taking medication. Osteoporosis is a bone disease, and the supplement associated with osteoporosis is calcium and vitamin D. Okay, so glucosamine is for osteoarthritis for the joint. Calcium, vitamin D is for osteoporosis for the bone. Okay, because many times the patient will come to me for osteoporosis taking glucosamine because they are taking the wrong supplement. It's a silent and serious disease. Okay, it can be treated early. Sunlight, exercise, and diet. Okay, and routine screening, especially for ladies nearing their menopause period or after menopause, the first few years, it's good to go for a screening and get it sorted out early. Okay, because the treatment for osteoporosis is quite complex after that.